Today we are going to discuss about a very common topic related to kidney failure, renal failure. It's called as AV Fistula. Dr. Shahzad, what exactly is AV Fistula and why is it important for dialysis patients?
Dialysis is something that a patient whose kidneys are not functioning is a procedure where the patient's body's blood is removed from the body.
Do you think fistula is a better option for dialysis patient or so then how do you decide which hand you will be using for the surgery? Like, do you do any specific checkup before
There is any abnormal swelling, complications to the heart, which it may cause at times.
a complication happens, we should be closing it or we should just be closing it once the transplantation is done?
I would recommend that the fistula is kept.
Namaste everyone. Welcome to yet another episode of podcast with me, Dr. Amitabh Kulkarni. This is a platform where we try to simplify complex topic. We invite experts in that field. We try to understand the topic in simplified language for common people's understanding. Today we are going to discuss about a very common topic related to kidney failure, renal failure. It's called as AV fistula. AV fistula is something like a lifeline for kidney dialysis patient. Those patients who are on dialysis, they know the importance of AV fistula. Today I am very happy I am joined by Dr. Shahzad, who is an experienced vascular surgeon, have been doing AV fistulas for years together, has helped countless patients for the same. Today we are going to understand what is AV fistula, how it is done, what precautions should be taken, what are the myths or misconceptions related to AV fistula which common people think, and we'll try to understand that in the simplified language. Thank you, Dr. Shahzad, for coming here and accepting our invitation. Dr. Shahzad, can you tell us something about your background?
Thank you, Dr. Amitabh, first of all, for inviting me and on your lovely podcast. So, I'm Dr. Shahzad. I am a vascular surgeon. I am born and brought up in Nasik, India, and been in the UAE for last over 3.5 years now. And a vascular surgeon is someone who deals with diseases of the arteries and veins, basically surgical issues. Arteries and veins of the entire body, except the heart and the brain, are dealt by a vascular surgeon. Open surgeries, endovascular procedures are performed by a vascular surgeon. And like Dr. Amitabh said, today we are going to talk about AV fistula, which is, as he mentioned, a lifeline for a patient who has a renal failure and who is requiring dialysis. Thank you.
Thank you, Dr. Shahzad, for the introduction. So, Dr. Shahzad, let's begin with the discussion. What exactly is AV fistula and why is it important for dialysis patient, like someone who is planning to do dialysis or someone who is already undergoing dialysis? It's very important for them. So, why is it important and what exactly is that?
So, to make it basic and simple, as the name suggests, AV fistula, it's a short form for arteriovenous fistula, means a connection between an artery and the vein. That's a procedure that is done so that a patient who requires dialysis, the fistula can be used for dialysis. And for that, in brief, I'll just explain what is dialysis and why we need the AV fistula for dialysis.
Right.
Dialysis is something that a patient whose kidneys are not functioning is a procedure where the patient's body's blood is removed from the body, circulated in a machine. The machine does the work of the kidneys, and the purified form of the blood is again has to be pushed inside the body, and that's what a dialysis is. And for that we need a process to remove the blood and push the blood in, and for that the AV fistula is considered the gold standard procedure to perform dialysis.
Yeah, so that was very simplified answer for what is AV fistula. Why can't we use the bigger vein in the necks, like a jugular vein or subclavian vein? Do you think fistula is a better option for dialysis patient, or even a catheter in jugular vein or subclavian vein? Is it enough? Femoral vein sometimes, yeah.
Well, yes, in the major veins, a tube can be placed, what we call central catheters for dialysis. But the small veins in the upper limbs cannot be used because, like I said, the dialysis machine requires a high flow of blood so that the blood can be circulated in the machine and the purified blood can be pushed back into the body. So the small veins in the hands cannot be used, but yes, the central veins or the neck veins or, like you said, the jugular or the subclavian veins can be used. But for that, we have to put a central catheter, like you can see in the diagram. A central catheter is a tube placed in the jugular or subclavian vein, and the tip of that catheter is close towards the heart into the superior vena cava or towards the right atrium, where blood can be pulled with a good amount of flow and pushed back into the body. But unfortunately, these catheters are prosthetic material or which can get infected. And that's why we generally try to stay away from catheters. But yes, sometimes they are also required and can be used for dialysis.
So fistula should be always a preferred option in this patient, you mean to say?
Yes, as long as a fistula can be constructed, always a fistula is considered a better option. But like I said, unfortunately, in certain situations where the patient's clinical status does not permit to create a fistula, we may have to go in for these central catheters, which are of two different types, which is a temporary one and a long-standing catheters, which are tunnel catheters, which are having less risk of infection, can be kept for longer duration. But again, they are catheters which can damage the veins in long term and make a creation of AV fistula also in the future difficult.
Right. So friends, please understand, AV fistula is always the preferred option whenever it is possible, whenever it is doable. Sometimes circumstances does not allow the AV fistula to mature for some reason. We may discuss this in the following questions. We will discuss that in following questions. But as far as possible, whenever there is doable, AV fistula is always the preferred access for dialysis in end-stage renal disease patient. So, Dr. Shahzad, when do you start seeing patients for creation of AV fistula? Like, when should it be done in this patient, in dialysis patient or a chronic kidney disease patient?
Generally, this decision is made by a nephrologist. You probably could give better idea, but yes, in short, as a surgical standpoint, once an AV fistula is created, that is an artery and the vein is connected to each other, it takes time for the fistula to be ready for dialysis. And that's why it has to be preemptively decided and planned that an AV fistula that a patient may require dialysis maybe in the next few months, and that's when you start planning for the AV fistula, because unfortunately AV fistula once created is not ready right away for dialysis. It takes time for maturation, and like you said, we'll come to that points a little more in detail soon.
Yeah. So being a nephrologist, I know that somewhere stage 4, when beginning of stage 4 or stage 5 anytime, we always refer the patient to a vascular surgeon for AV fistula. Now, Dr. Shahzad, we have seen many, the moment as a nephrologist, when I refer someone for a surgery to you, they are scared. They think probably it's a big surgery and all. So, is it really that worrisome or that scary sort of surgery, or is it a simple surgery? What message you want to give to those patients who have been advised for AV fistula by nephrologist recently?
Yes, generally speaking, it is not a very major surgery, but like you said, it requires preemptive planning, and also the surgery takes time and the patient's acceptance takes time. So if you send a patient to a vascular surgeon in advance, they can explain to them what is an AV fistula, and so that they can understand and not be scared, and the planning can be done more appropriately. So yes, AV fistula is a surgery if planned in advance and properly examined the veins and arteries, is a relatively small surgery, can be done under local anesthesia, and no major cut required, only a small cut close to the artery and vein that we are connecting. And as you can see in the diagram, it is the skin vein that is connected to an artery, and there are 2-3 different options that you can see in the diagram.
So, viewers, please understand this is a surgery, but it's a very minor surgery with a small cut done under local anesthesia, and it isn't as painful as you may read somewhere. It is a simple surgery, and it's a lifeline. So, better to do it as early as possible whenever your nephrologist advise you. Now, if a patient is planned for a surgery, what should he expect? Like, what preparation he need to do for the surgery? Does he have to do any specific preparation before AV fistula surgery is planned? What is your advice for someone, suppose who is going for surgery in next couple of weeks or few weeks? What is your advice?
Very good question. One of the part of preparation for AV fistula is that, as you saw in the diagram, that the skin vein is used for constructing the AV fistula. So we try to explain to the patients that they should avoid any kind of blood sample collection or any kind of IV medication given through those veins that the doctor has told you that yes, this vein we are going to use for creating the AV fistula. That limb that has been decided, avoid any blood collections, any blood pressure measurements, and also we explain to the patients the other important about preparation is doing some hand grip exercises, which we call so that the veins are developed better and the fistula success rate is better.
So then, how do you decide which hand you will be using for the surgery? Like, do you do any specific checkup before planning a surgery for
Absolutely.
Yeah.
So again, a very good question, because it's not that okay, AV fistula is required, you go to a surgeon and they will be able to right away create the AV fistula. There are certain criteria that we assess on an ultrasound, a simple sonography ultrasound, what we call. We check the veins in the patient's upper limbs and decide which is the best location to create an AV fistula. And then we try to save that limb and the veins to create the AV fistula.
That was very simple explanation. Now, if a patient has undergone a fistula, say today, is it good for use for dialysis, or does he have to wait for some time before it can be used for dialysis purpose?
Yes, that's why we preemptively plan, because once we do the fistula, it takes time to mature, which we earlier mentioned, and the basic timeline is around 6 weeks is considered that a fistula should be ready. But again, from patient to patient, the size of the vein takes maybe sometimes 8 weeks, 10 weeks, and we may have to do sometimes a endovascular procedure, what we call an angioplasty, to make the vein mature. Now, other important part is, what do you mean by maturation? So maturation means the vein that initially may be around 2.5, 3 millimeters in size. We want that vein to reach a size of, as per books, around 6 millimeter, and anywhere above 5 millimeters, 6 millimeters, or is considered a good vein size. So basically, when the pressure from the artery pushes the vein, it increases the size of the vein, which is small, and then slowly with time it goes to that size that we want, what we call as maturation. And that's why we have to wait and we have to monitor if the vein is ready for dialysis, because it's not only the size, but it is the thickness of the vein, the depth of the vein. So we look at all these criteria, as you can look in the diagram. The one needle has to be placed into the vein, which will pull out the blood, and then another needle is again pushed into the vein for pushing the blood back in.
Viewers, please understand, even if a fistula is done today, we cannot use it immediately because it has to mature, as Dr. Shahzad explained. But then, Dr. Shahzad, can you tell me how will the patient know whether his fistula is getting matured? Can he decide, or you decide, or a nephrologist decide? Is there any assessment method to see if the fistula is ready for use now?
Yes, very important. The patient, once a fistula is created, is asked to assess the fistula by himself. The medical words for this are what we call as thrill, is that when you touch the fistula or the vein that has been connected to the artery, you feel a machinery sound or a machinery feel when the heart beats. With every heartbeat, there is like a thrill, that's like a flowing, the blood flowing that you can feel under the
Fistula,
hand.
correct.
Yes, and that has to be monitored regularly because yes, unfortunately, when these veins are connected to the arteries, the fistula may not always mature, or there is always a risk of clot formation because we have turning the flow of blood and there is turbulence of flow in the of the blood, and that's why there is a risk of clots. So a patient is asked to assess the fistula functionality every day, and if any abnormality in the feeling, patient is asked to follow up immediately.
But then, do you also have to see this patient periodically after the surgery before it is being used?
Again, yes, obviously, after any surgery, we call the patients for a regular follow up. The first follow up is generally between 5 to 7 days, and plus for the wound healing, generally these patients are diabetic also many times, so there is always a risk of wound infection. We have to closely monitor the wound once the fistula is created, so a regular follow up with the surgeon until the wound heals is very important, which is approximately around 2 to 3 weeks. And after that also, like I said, the fistula maturation is expected around 6 to 8 weeks. So then we call the patient again at the 6th week, monitor on the ultrasound to check the size of the vein, to check the flow inside the fistula, is it ready for dialysis or not.
Right. So, friends, viewers, please understand, the day surgery is done, the job is not done. You still have to monitor fistula. You can see it yourself with the thrill, or you can get it checked by the surgeon or nephrologist which you have been seeing. Now, in spite of doing a surgery, sometimes we have seen the fistula does not work as expected immediately or over a period. So, are there any signs the patient should be watching for in the fistula wherein they will understand that okay, there is something wrong with the fistula and they should report it to either you or the treating doctor immediately? Are there any signs they should be watching for?
Yes. So, like I said, feeling the thrill is one thing. The other things are if there is any abnormal swelling after the fistula creation, or that the patient is noticing, patient should see the physician. And this is about fistulas which are recently created, but fistulas which have already been functioning and are being used for dialysis also need to be monitored on a regular basis. If the patient does not feel a thrill, or if there is an abnormal swelling in the fistula, the size of the fistula does not look correct, or a skin has showing any discoloration, are all different things that a patient should look at while assessing their fistulas. And not only the patient, but obviously the dialysis team also can assess the fistula. During dialysis, they see the flow of the fistula. If there is any reduction in flow during dialysis or any restriction in flow during dialysis, all these are signs which need to be assessed to make sure that the fistula is functioning properly and can be maintained.
Yeah, so it's understand it's an ongoing responsibility, patient as well as the treating doctor, to make sure that fistula is working properly. And as Dr. Shahzad clearly said, that fistula may not function as expected even years after its creation. So you need to watch it regularly, and the moment you find something abnormal in the fistula, you should report it your treating doctor, whether it is the nephrologist or whether it is the vascular surgeon who has done the surgery. Report to them immediately so that some measures will be taken as early as possible. So that was very informative. Now suppose once a fistula is done and it has been functioning well, patient is happy. So is there any specific care they have to take to make sure it shouldn't stop suddenly, or there shouldn't be any malfunction of this fistula?
Yes. So if the fistula is even working fine, they should be regularly monitoring like we discussed, and they should see the surgeon even if the fistula is working fine. Either the nephrologist or the vascular surgeon, they should see them every 3 months or so. And we can check certain things on the ultrasound and the flows of the fistula, or sometimes the fistulas go into a ballooning, what we call as an aneurysm. or a narrowing somewhere can be developed, which can be assessed. If timely assessed, we can prevent formation of blood clots in these fistulas and treat them timely so that the fistulas can run for years and years if taken good care. It's just like doing servicing of our car, we need to service our fistulas.
Correct. So it is a continuous work from both patient as well as doctor's side to make sure the fistula is working properly to give the maximum result from dialysis. Now, Dr. Shahzad, we also see there are some patients who are referred to you for AV fistula, and then you say, no, you are not good for AV fistula. We are very sorry, we will not be able to do AV fistula surgery for you. Now, that is probably very disheartening for the patient as well as the referring nephrologist. So, what circumstances you suggest patient that you tell patient that we cannot do a fistula surgery? Not only that, if you are not able to do a fistula surgery, then there has to be some solution for the patient. So what exactly do you suggest to them?
Unfortunately, the patient does not have a good vein, or actually even a patient who's had a functioning fistula and for some reason gets clotted or has a problem and cannot be used for dialysis, then the next option is creating an AV graft. It is an arteriovenous graft, which is again a plastic or prosthetic, I mean to say, material which is placed inside the arm. So it connects the artery and the vein, and it does the function of our natural veins, which the patient may not have sufficient size or sufficient length of the vein to create an AV fistula. And then we advise them in what we call as an AV graft that can be created. So yes, there is never a situation where we cannot offer a patient an access to dialysis. There are always some option or the other that we can give the patient for dialysis.
Yeah. So surgical option in addition to AV fistula is AV graft, as Dr. Shahzad mentioned. But then, is there any difference in functionality, like between AV fistula, AV graft? Can it be used immediately, or is there any convenience or inconvenience related to AV graft for patient?
Well, yes, the first option obviously is the vein, because it is a natural part of the body. The risk of infection is less. Though it may take some time to mature, that is the advantage of a graft sometimes, that it does not require so much time to mature. It is already a tube that is placed inside and can be used faster than a fistula for dialysis. But yes, again, it is a unnatural material. It is not body's material, so body may reject it, or it can get infected and sometimes have to be removed the graft.
So then, any suggestion if it is getting infected, or any precautions they need to take if it is getting clotted or anything?
Yes, absolutely. The good thing about the graft is if it gets clotted, it can be opened up through different procedures. The clots can be removed or dissolved,
Right.
As opposed to a natural AV fistula, which becomes difficult to revive after a clotting inside the vein. Regarding the infection part, yes, very important for patients to keep the area of the graft clean and dry. And obviously the other part is also from the dialysis team. They have to take more precautions to be, perform the dialysis in a very sterile way, so that the grafts don't get infected. Even after everything, they may sometimes get infected. So the signs in that are the patient may have some fever, some redness over the graft area, and they should immediately visit their nephrologist or vascular surgeon to get it checked.
Friends, please understand, graft is a synthetic material. Obviously, a risk of infection is there, and so you have to be more careful, especially if you are using AV graft for your dialysis. Now, coming back to the next question related to today. Now, a patient was using AV fistula. He was lucky and he underwent a kidney transplantation. Now, AV fistula is still working, and frequently, me as a nephrologist do encounter these patients' questions like, what next for this fistula? This is not in use now. I have already done a kidney transplantation which is working well. So, what do you do with those fistulas which are not being used for dialysis now, and we just close it, or we just leave it as it is, or anything specific can be done for this?
Well, I mean, if fistula, if it's being used for dialysis, also it is lasting for sometimes 8-10 years also or more. Similarly, if fistula is kept open in a transplant patient, as long as it's not bothering the patient in terms of any physical pain or discomfort or psychological stress, it can be left in place. But yes, fistula for either because of some patient symptoms or sometimes if the fistula is causing some complications to the heart, which it may cause at times, the fistula can be closed. Just like it is created, it can be closed too by a small surgery.
Yeah. So, does that mean that only if a complication happens, we should be closing it, or we should just be closing it once the transplantation is done?
I would recommend that the fistula is kept for some time, as long as it's not bothering the patient or having any complications.
Right.
Because even with transplant, life or the life of the transplanted kidney may also be limited at times, and it is always safe to have the fistula functioning, because once we close it in the future, if required again, that site for fistula has been lost.
So unless there is some problems or complications happening because of fistula, you would not recommend to touch it, even if you are not using it for dialysis, your transplantation is done, everything is going well. We'll just leave it as it is. It's not going to bother you. Okay, that comes to the last question for today's discussion. What advice will you give to those patients or say family members who is hearing for the fistula, AV fistula for the first time? Me as a nephrologist, I'll tell you, it's a hard decision. Sometimes patients' acceptance is a big hurdle for dialysis. The moment we tell them that you may need dialysis in future and you may need AV fistula, so please meet surgeon for AV fistula. What is your advice to those people who are hearing AV fistula for the first time?
Yes, so in summary, AV fistula once has been advised to you. First, just go and meet the vascular surgeon, understand what is AV fistula, understands the risk benefits of an AV fistula, why it has to be planned in advance, because there is always an unfortunate risk that these AV fistulas are never 100% successful, and if it's not ready before dialysis, may require a repeat procedure. So rather than being anxious and scared, understand the procedure, understand its advantages, start creating the fistula in advance. And like we discussed, even if it is created, even if the patient does not require the dialysis, even if the fistula stays in the body for months and months, it is not generally going to harm the patient. So don't be afraid. Go speak to your doctors, your nephrologist, your vascular surgeon. Understand the fistula. Get it done in time, so you will be in a better situation.
Thank you very much, Dr. Shahzad, for this very simple explanation related to AV fistula. That brings us to the end of this interesting podcast. Remember, friends, dialysis patients, AV fistula is lifeline. A good AV fistula can give them a good quality dialysis, which is going to improve their lifespan, improve their longevity. So taking care of fistula from day one, or maybe minus day one, when the fistula is being planned, is your responsibility as well as the treating physician's responsibility. A dialysis patient often encounter fear, misconception related to AV fistula. I hope today's podcast will help all those patients, all those relatives clear their doubts related to AV fistula. The purpose of this podcast is to select a topic and learn it directly from the expert in the field, so that more and more people will be benefited. Those people can be patients, those people can be patients' relatives, those people can be even healthcare professionals. So our purpose of this podcast is to increase the healthcare awareness as much as possible and to hear it directly from the expert. Thank you, Dr. Shahzad, again. Viewers, if you have any questions related to today's topic, please write it in the comment. We will be very happy to answer to those questions. If you want any specific topic from Dr. Shahzad related to vascular surgery in future, please write it in the comments. Please like the channel, share, subscribe, share it with people who need to understand what is AV fistula, who the relatives of the patient who are undergoing dialysis. Thank you very much. Thank you.
Thank you, Dr. Abhithik.